Ronell Nolan, President, CEO, Health Agents for America, coming at you live this Monday. Much love to those still cleaning and who do not have power because of Hurricane Ida, and all those preparing for Hurricane Nicholas, our Texas coast and going up through North Louisiana, and those affected by floods and fires. And it's just, if it's not COVID, it's something. So my thoughts and prayers go out to you, and if you need anything, please let me know. The title of our talk today is Don't Put It Off, It's Not Gonna Hurt. Basically, I'm talking about open enrollment training. Very easy. You're a returning agent. Very simple. I'm going to tell you it's going to take you a couple of minutes. There's no test. There's a little bit of information about ARPA. That should be pretty fresh. You should know about ARPA. I talk about it all the time. And the longest thing is just tabbing through the contract and signing the contract at the end. Other than that, it's easy. So do not put it off. Go ahead and take care of it way in advance of the November 1st effective date. And again, open enrollment will start November 1st. What we know, it'll probably be through January 15th. So go ahead and prepare. But what I'm thinking is maybe you just plan on it ending 12/31 as far as getting all your enrollments done, and that'll give you an extra 15 days to do cleanup. Anything that anybody you didn't catch, anybody who waited to the last minute that may be a prospective client. Remember to sign up on Help on Demand, free leads coming directly to you. It's set up on your iPhone, your smartphone, that you can actually sign in with your face now instead of trying to remember what your password is. You have 15 minutes to respond, and you're going bananas trying to figure out what you were supposed to remember. So they're making it a little bit easier, but please sign up. You can set that up to get leads, a certain time of the day, certain days, make sure to set that up. And then also, when you're signing up to do your marketplace training, you will put on there so they can put on the marketplace when you want to take prospective clients. If someone goes in and says, find an agent, they pull up your name and it tells what days you're open and what hours you're open. So very, very important to get that information done. For those that are thinking about getting in the exchange for the first time ever, we do not know when that training is going to be available. I'm hoping it's going to be in the next month or so, but I will keep you abreast. There are several new classes that are available. The first one being September 23rd, prepare for open enrollment. There's one on operational updates, help on demand, and how to help consumers enroll on October 21st. So that's in your Monday morning news. Pay attention to that. Go ahead and get signed up. Knowledge is power. IRS released the new ACA affordability rates for 2022. They have gone down, decreased to 9.61%. So you need to know that. That information is from the Wagner Law Report and definitely included in your Monday morning news. This morning, I got an email from Congressman Crenshaw's office about some information they were going to be reviewing, some legislation reviewing in energy commerce. I sent it to my legislative team just to take a look, 27 pages. The things that stick out is giving more money to the Navigators, and something that we have said from day one was the user fees that insurance companies must pay to play in the exchange being used for Navigators. We've said that forever. In this document, it says 10 million being pulled out of the user fee to be used for Navigators. Now, I do not think it's fair that every insurance company, that every consumer should pay for a program that is inefficient and does not work. In responding to Congressman Crenshaw's office, I referenced a Think Advisor report that was done in 2019 that showed that navigators were being paid between $5,000 and $6,000 per policy. I did not stutter, so I'll say it again. $5,000 to $6,000 per policy. Now, agents and brokers are simply asking to get paid a fair wage. My folks in New York are being asked to be paid anything. They're being paid nothing. In many cases, people aren't paying for during SEP. They're not paying in specific states. It's wrong. It's wrong. User fees are being paid for navigators. Tax dollars are being paid for navigators. Agents and brokers are not getting a fair wage. And we're continuing to work 24/7 for our consumers. So if you want to make navigators just do education, just do that. Do education. Don't let them sell. Or why don't you make them be licensed, educated, and carry E&O? I'm working with Congressman Harshberger's staff on possibly filing legislation to do just that. In addition, to force them to be transparent as we have to be transparent on our commissions. When they are helping someone to say, hey, I'm getting paid $5,000 for helping you today. Now, wouldn't that be nice to be transparent by the federal government? Private industry, we're required to be transparent. Doctors, hospital, insurance agents, they want us to be transparent. But how about the federal government be transparent? Let's have the navigators, the call centers, everyone that's helping a consumer, let them be transparent about how much money they are making. Fair is fair, right? Fair is fair. So more information on that, both of those pieces of legislation and proposed legislation. But I hope you have a wonderful and safe week. Please let me know if I can help in any way. I'm working on getting those CE credits uploaded to your respective states for those that attended our summit. We had a wonderful summit, and thank you for traveling from all over, and so happy that you got out of Louisiana before Hurricane Ida hit us. So until next Monday, Rynell Nolan, President, CEO, Health Agents for America, proud and honored to represent the freedom fighters, the cream of the crop, the best of the best.